I'm Karen Doyle. I'm the Vice President for Nursing and Operations here at the Shock Trauma Center. And this new building is just such an incredible opportunity to elevate the standard of care that we provide in terms of state-of-the-art technology, new critical care rooms that provide accommodations for families so the families don't feel like they're intruding, we don't feel like they're intruding. It provides additional capacity to treat the number of patients that are coming through our building. At this point, we treat about 8,000 patients a year. This building is 20 years old and it was designed to handle approximately 3,500 patients a year, and we are seeing 8,000 patients a year, so you can see that the capacity is really stretched. And so we've become masters of efficiency, but you can only be so efficient. And so the ability to have this incredible new building allows us to just handle the sickest of the sick that require our services in the state of Maryland. Well, if we're seeing 8,000 now, it should be able to provide additional capacity. I would think in 10, 20 years we could double that capacity as well. So our ability to have the National Training and Simulation Center here provides us a great platform to continue our expertise with training and education. We have an incredible relationship with the Air Force. We have our Sea Stars program. And the way we should be training individuals is with simulation. Many of our men and women that come here with the Air Force, they get to see our high volume of patients, and they get deployed immediately to the front lines of the Iraqi and Afghanistan war. So our ability to provide simulation to those individuals is important. And it's also important to our field staff with the Maryland Institute of Emergency Medical Services Systems. We can provide training to our field providers so that they can simulate their environment that they're in when they encounter a victim of a motor vehicle crash, motorcycle collision, those kinds of things. We're the only trauma hospital in the country, and arguably the world. I think there are one or two around the world these days. But we have this world-class global center of excellence that doesn't look like we are a global center of excellence. And having this building really represents the world-class patient care, science, and leadership that we provide on a daily basis. Having this building, it's more than just a building. We talk a lot about it being the building, and that is fantastic. And we're incredibly grateful to everyone who has supported financially our ability to have this building. But what's really important is that what makes the center so great are the people that work in this center, and everybody, physicians, nurses, all the support staff that make this a world-class center will continue to make it a world-class center. They'll just now be able to provide this type of care in an environment that is just much more conducive to providing extraordinary care to our citizens of Maryland.